First, I would like to thank the Singaporeans for their support for the proposed changes to the MediShield. Many of them have also contributed with very useful ideas. Some of these ideas have in fact been taken up in the revised MediShield. For example, some suggested that we should remove the limit entry age for MediShield, like we've done there. Some have suggested that we should raise the MediSave withdrawal limit so as to allow them to use more to pay for their MediShield premium. We have also adjusted that. There are other key changes would also include raising the coverage age to 90, extending coverage to psychiatric treatment, inpatient psychiatric treatment, as well as raising the lifetime limit and the policy year limit on MediShield claims. So these will go a long way to help our patients, provide them with basic healthcare insurance coverage. I think with regard to the congenital and neonatal condition coverage, we have studied the idea in depth. We have studied very carefully, and in principle, we are quite supportive of providing greater support to help our children and their families pay for their children's healthcare costs. That's why the Prime Minister suggested during the National Day rally that we are considering setting up a MediSave account for the newborn babies, and also for the government to consider putting in a small sum of money to help them start life healthily. So I think in principle we are supportive, but it is important for us to also not look at these measures in isolation of each other. We should look at it in a more comprehensive way. It is also related to the overall debate on marriage and parenthood, as well as our Singapore conversation about what kind of Singapore we want to have in the future, what kind of home we want to nurture in the future. And therefore we've decided to surface this issue of congenital and neonatal coverage for our Singapore conversation to be discussed at the various platforms and to be considered as we discuss the measures for the marriage and parenthood package. I think this will be a surface for them to discuss further before we make a final decision.